day, and thank you for joining us. As a participant on today's webinar, you are part of a larger audience and all attendees are in a listen-only mode. If you need technical assistance, please use the chat box in the lower left-hand corner of your screen to communicate with us, and we'll do our best to assist you. During the webinar, you'll be invited to ask questions, and you can do so by typing them in the box on the left-hand corner of your screen. Questions will be answered at the end of the presentation. Now I'd like to turn this program over to your host and moderator, Mr. Tom Schaefer.
Thanks, Catherine. Welcome to CDC's Adolescent Immunization Webinar Series. I am Tom Schaefer with the National Public Health Information Coalition, and I will be your host today. Joining me is Catherine Martin, the Executive Director of the California Immunization Coalition, who will assist with the Q&A after today's presentations, as well as provide an update on the National Immunization Awareness Month Toolkit. Today's webinar, Back to School Showcase, Resources to Help You Become an HPV Champion, is the latest in a series we coordinate through the Virtual Immunization Communication Network, or VIC Network, to provide the tools and resources you need to communicate about the importance of immunizations. The VIC Network is made up of more than 3,000 public health communicators, health educators, immunization coalition members, doctors, nurses, and others interested in doing a better job of explaining why immunizations matter. Now, summer is typically the unofficial start of the vaccination season, the period of the year when school-age children are receiving the vaccines they need before they start school in the fall. Presenters will discuss upcoming HPV vaccination campaigns and resources to help healthcare professionals take advantage of the back-to-school timeframe to boost HPV vaccination rates. In addition to the HPV discussions, Catherine Martin will focus on preparations for National Immunization Awareness Month, which takes place every August and offers the ideal opportunity for educators, communicators, and advocates to work together in promoting the importance of immunizations. A NIAM toolkit is developed by CDC and NPHIC contains resources, including important facts, sample articles, and news releases, Facebook posts, and tweets you can use in August and throughout the year. Now, before we begin, there are just a few housekeeping items I want to run through. As a reminder, there is no dial-in number associated with this webinar. Please make sure your speakers are connected. All participant lines are muted. This webinar is being recorded and will be available online after the broadcast, as will the slides. During the webinar, you may ask questions by typing them into the question panel at the lower left-hand corner of your screen. Selected questions will be read aloud for the presenters at the end of the presentations. Now it is my pleasure to introduce our presenters. First is Ian Branham. He is a health communications specialist in the National Center for Immunizations and Respiratory Diseases at the Centers for Disease Control and Prevention. Ian has been supporting health communication activities in NCIRD since 2014 and currently leads activities for CDC's HPV Vaccine as Cancer Prevention campaign. Ian has also supported NCIRD's public affairs portfolio, including supporting the media response during the 2017-18 flu season. He earned his master's in journalism and mass communication from the University of Georgia. Secondly will be Jennifer Cinco, who leads the National HPV Vaccination Roundtable work on HPV vaccine communication and public engagement through social media, and manages the digital footprint of both the HPV Roundtable and the newly formed HPV Cancer-Free Families Facebook group. Prior to her work with the HPV Roundtable, Jennifer was a special assistant to the President's Cancer Panel, where she helped research, write, and publish several reports, including Accelerating HPV Vaccine Uptake, Urgency for Action to Prevent Cancer. She received her MPH from the George Washington University. And finally, Catherine Martin is the Executive Director for the California Immunization Coalition and works in partnership with coalitions and organizations that support their mission of ensuring that everyone has access to life-saving vaccines. In addition to her efforts in California, Catherine works with partners around the country to support coalition development and to create effective advocacy, can't get that word out, and education campaigns. Each year she has worked with NPHIC and others to help put together and promote the NIAM Toolkit. Now, before we get started, and I hand this over to our presenters, we would like to take a quick poll. The question is, does your office routinely recommend HPV vaccination to parents as part of the preteen health screening? And you see the 5 different responses that you can give there. Please just make your selection and hit submit, and we'll see what we've got. Great, thanks for answering those. It looks like we've got a good group here. The majority, we're up about 70% to take every opportunity to do that, so that's good to know. So now I'd like to turn it over to Ian. Ian, you're up.
Great, and thank you for that introduction. I'm excited to have the opportunity to talk with you about our HPV campaign, as well as launch the 2018 HPV Vaccine as Cancer Prevention Champions Award. So to start, I wanted to provide a little bit of background on the HPV campaign and some of the research that's informed our efforts. The campaign has existed since the first HPV vaccine was licensed in 2006, and throughout the campaign, the key audiences we have targeted have been parents, preteens, and clinicians. 2 of the messages that have been central to the campaign include emphasizing the important role HPV vaccination plays in preventing cancers, and stressing the importance of vaccination at the recommended ages of 11 to 12. Over the past several years, the campaign is really focused on helping clinicians learn how to make an effective and bundled recommendation, as well as addressing parents' questions and concerns about HPV vaccination. To provide an overview of some of the key findings of our research with parents, we know that parents are generally confident in HPV vaccine, including the importance and benefits of HPV vaccination. However, parents do have questions about safety, which can range from questions about the pain, side effects, or duration of protection. Parents may also have questions about how vaccination impacts future fertility. It's important to note that questions don't mean a lack of confidence in HPV vaccination. The main barrier seems to be on-time vaccination at the ages of 11 to 12. We've seen that some patients and providers want to delay vaccination until the child is older. We also know that the main facilitator of HPV vaccination is the provider recommendation, which is the #1 reason parents decide to get the vaccine for their child. And now I want to talk about some of the lessons learned from our research with providers. One lesson learned is that while parents value HPV vaccine just as much as other adolescent vaccines, providers perceive that parents value the vaccine less than other adolescent vaccines, which can influence how they talk about the vaccine with parents. Additionally, overall, pediatricians reported that they felt confident they could address specific parents' questions and concerns before their 13th birthday. And again, we've seen on-time vaccination at 11 to 12 as a barrier among providers. A majority of providers say that they routinely recommend it at 11 to 12, but the top reason for not routinely recommending at 11 to 12 was that they anticipated parental refusal or hesitancy. We've also seen that there's a lack of awareness on the part of some providers about the benefits of HPV vaccination beyond the prevention of cervical cancer and genital warts. And in other words, they may not be thinking of the full scope of cancers and precancers that HPV can cause. And again, we found that parents trust and listen to their providers, and their recommendation is key to making parents feel comfortable in their decision to vaccinate. And now with that, I'd like to segue into the revamped campaign that we launched earlier this year that I'll be discussing today, which really hones in on 4 key segments of physicians. We conducted an online message testing survey with pediatricians, and we found that most physicians, about 71%, fell into at least one of the 4 segments that we had identified as benefiting from tailored messaging. The new ads launched in April of this year, and they'll be running through the end of summer to take advantage of that back-to-school timeframe. And on the next slides, I'll provide some more information on those segments and the materials tailored for each of those segments. On this slide, you can see a preview of the ads for our new campaign. I'll go through each of the segments in a little bit more detail in the following slides, but you can see that there are different messages targeted to each segment. So in the first ad is the clinicians who think the HPV vaccination is important, but they're doing fine with their coverage rates. In the second ad, this is targeting the clinicians who think that HPV vaccination is important for their patients who are at high risk for HPV infection, but not for everyone. In the third ad on the bottom left, this is targeting clinicians who don't think the HPV vaccination is important for their adolescent patients because there are cervical cancer screening. And then in the fourth ad on the bottom right, this is targeting the clinicians who don't think the vaccine is important enough to really push to parents. With that, I'll move on to talk about these segments in a little bit more detail and some of the materials that are available that are targeted to each of these segments. So the first one that I mentioned, the clinicians who think that HPV vaccination is important, but we're doing fine with coverage. We know that clinicians often compare their practice HPV vaccination rates to those of the state or the nation, and therefore think that because they're doing better than their state or national average, then that they're doing all that they can. And they may not be comparing their HPV vaccination rates to the rates of other adolescent vaccines that are routinely recommended, such as the Tdap and meningococcal vaccines. So in this light, some clinicians believe that they are doing all that they can to improve rates, but they may not realize that other clinicians have achieved high vaccination rates because they've been able to implement changes in their practice. So we developed a fact sheet and web page on the top 10 tips for HPV vaccination success, which offers 10 practical and proven tips that providers can implement in their practice to improve their rates. And moving on to the second segment that I mentioned, we've also found that some clinicians recommend the vaccine for patients they deem to be at high risk for HPV, rather than recommending the vaccine routinely for all their 11 to 12-year-old patients. We recently worked with practicing physicians to develop a new CME activity titled HPV Vaccination at 11 to 12 as a Standard of Care. And this CME features a panel discussion of 4 pediatricians talking about how they routinely recommend HPV vaccine for all their preteen patients, including how they make an effective bundled recommendation, answer parents' questions, and handle parental refusal in their practice. The third segment that I mentioned, the not important because we have screening, because HPV cancers are not an immediate problem that would present itself in adolescence, research shows that some pediatricians may not see it as relevant to their practice. So to address this, we developed an infographic designed to highlight the true burden of cancers that HPV causes and really reinforce the importance of vaccination to prevent cancers in the future. So using the analogy of an iceberg, the graphic depicts cervical cancer as just the tip of the iceberg and really highlights the burden of cervical precancers and other HPV cancers that providers may not be considering as the part of the iceberg that's underneath the surface. And then moving on to that last segment that I mentioned, we know that based on anticipated parental refusal, some clinicians may treat HPV vaccine discussions differently when compared to other adolescent vaccines. We've also seen that most parents will accept HPV vaccination when it's recommended on the same day and in the same way as other preteen vaccines. So we've developed our tips for talking to parents about HPV vaccine fact sheet and webpage, which is designed to assist providers in making a simple, concise recommendation for HPV vaccination on the same day and in the same way as other adolescent vaccines, as well as providing brief responses to some of the most common questions that parents have. And now I'd like to share some additional new and updated resources we have available that hit on kind of one or more of these segments. This past fall, we launched a new video series called How I Recommend. And in this series of short videos, practicing clinicians explain how they're achieving high vaccination rates and effectively answering parents' questions. We currently have videos with 4 pediatricians and a family physician, and these videos range, the questions that we ask in these videos range from questions about how to make an effective recommendation to how to answer questions about vaccine safety to how to handle parental hesitancy or refusal in their practice. And continuing with this series, the next phase of videos that we're developing will feature some nurse practitioners, and so those will be available sometime later this fall. One of the products that we've had for several years is our You Are the Key to HPV Cancer Prevention slide deck, which really provides all the key information about HPV infection and disease, HPV vaccine recommendations, and how to have a successful conversation with parents about HPV vaccination. And we've also made this slide deck available as a CME activity on our website. So moving into a few of our newer resources, we recently developed a new clinician listicle. And if you're not familiar with the term listicle, it's short for list article. So it's basically an article that's broken down into a list form to make the content a little bit more digestible for the reader. In this new listicle, we provide 5 practical and proven strategies that providers can implement in their office to improve their rates. And each of the items in this article is accompanied by a corresponding graphic, which is designed to make it easy to share on your social and digital platforms. And you can see a preview of one of these graphics on this slide. I also wanted to highlight a new resource, which is our template reminder letter, which providers can use to send to parents to remind them of the vaccines that their children are due for. And it includes information about all of the routinely recommended adolescent vaccines, so it really reinforces that approach of bundling the adolescent vaccines together and not singling out HPV vaccine or making it seem different from the other vaccines. And then the last resource that I wanted to highlight is our new parent listicle, which is 6 reasons to get HPV vaccine for your child. And it's really to educate parents on the important role of HPV vaccination in preventing cancer for their child. And it provides 6 compelling reasons for them to get the vaccine for their child, each reason accompanied by a graphic that can be easily shared through social and digital media platforms. And with the last few minutes, I just wanted to highlight our HPV Vaccine is Cancer Prevention Champions Award, which we're launching this week, and we'll be starting to accept nominations for the award. The HPV Vaccine is Cancer Prevention Award is an annual award that we partnered with the American Cancer Society and American Association of Cancer Institutes on, and established in 2017 to recognize healthcare professionals who are going above and beyond to foster HPV vaccination in their communities. One of the things that's a little bit different this year is that rather than last year we had a champion for each of the 10 HHS regions, and this year we're actually opening up the award to all of the U.S. states and territories, so we'll be accepting nominations from all state and territorial immunization programs. And the state and territorial immunization programs will also be coordinating the review and the process of reviewing and submitting nominations to CDC. Moving on to the next slide, just wanted to provide some information on the criteria for nominations. So there's minimum nomination requirements, which are that it must be a clinician, clinic, practice, group, or health system that treats adolescents as part of their overall patient population. And they also must have a minimum vaccination coverage level of 60% series completion according to the ACIP recommendations for the patient population aged 13 to 15 years. And then additionally, in order to showcase the nominees who are really who are really leaders and innovators in HPV vaccination, champions should also meet one or more of the following judging criteria, and those are leadership, collaboration, and innovation. And we also have some information on our website, and there's a nomination packet which includes some more details on each of these requirements. And then I just wanted to briefly go over the nomination timeline. So this week we will be sending program materials to immunization programs, informing them about that we'll be accepting nominations and providing materials to assist with soliciting nominations for their area. And we'll also be updating our website with all of this information. We're encouraging states to receive nominations in August 2018. The suggested deadline is August 10th, 2018, but we encourage individuals to contact their state immunization program if they have a specific deadline. Additionally, we encourage states to submit their nominations to CDC in September, specifically September 14th, 2018, and we'll also be sending out this information this week. And then in October, we'll be CDC, in conjunction with American Cancer Society and the American Association of Cancer Institutes, will be announcing the champions. And then on the last slide, I just wanted to mention some of the materials that we developed that we'll be sharing to support efforts to submit nominations, which include a one-pager about the award that can be used as can be adapted as talking points or as a sample ready-to-publish article in newsletters or on your website. We'll also be developing a nomination announcement email template to send to potential nominees. I mentioned that we'll be sending a packet with nomination forms and with the nomination form and nomination instructions, and then additionally sample social media posts that that you can use to promote to encourage nominations. And with that, I'll move to my last slide. If you have any questions, if you'd like to find any of these resources, I've included contact information as well as the link to our HPV website. And with that, I'll hand this off to Jennifer.
Hi. Thanks, Ian. So my name is Jennifer Cinco. As I was introduced, I'm with the National HPV Vaccination Roundtable, and I am one of the directors, and I focus on our communications and public engagement work. Here we go. I'm really excited today to tell you a story, and this is the story of our summer campaign called The Power to Prevent HPV Cancer. So we have some great heroes, and the heroes are our content, and we need a little help, and that's where you'll come in. But first, let me introduce you to the HPV Super 6 Hero Team. This is a team of superheroes with the power to prevent HPV cancer. Each superhero represents a clinical audience and is powered by a clinical action guide. Each action guide was carefully developed and rigorously reviewed by experts in each target profession and includes specific tools to help HPV Super 6 heroes activate their special power to prevent HPV cancers. We know how hard it can be for heroes to keep up with and compile the latest research and evidence base for increasing HPV vaccinations on top of all of their other responsibilities. That's why the National HPV Vaccination Roundtable created 6 easy-to-use clinical and system action guides. Each guide contains tips and time savers for increasing HPV vaccination rates and has been rigorously reviewed by experts in each target profession. These guides are grounded in evidence from trusted sources such as the Centers for Disease Control and Prevention. We've done the heavy lifting and made it super easy for clinical audiences to find and implement trusted, evidence-based strategies for increasing HPV vaccination. While there is consistent messaging and information across all of the clinical audiences, there is important role-specific content for each audience. All of the guides include information on facts about HPV cancer and vaccination, why it's important to prioritize HPV vaccination at the pre-adolescent age, and suggested actions and interventions for each clinical guide audience to take. So for those of you on the call, if you see or treat 11 to 13-year-olds as part of your practice, your clinic, or your health system, we invite you to join a powerful team of 6 superheroes, all of whom have the power to prevent cancer by recommending, delivering, or prioritizing the HPV vaccine. You have the powers, and now you have the tools. The 6 clinical and system action guides will help you and the rest of the HPV Super 6 heroes prevent up to 6 cancers caused by HPV infection. The HPV Super 6 are headquartered at hpvroundtable.org/power. And I encourage you to visit them to check out the content, including the action guides and useful tips and tricks. So the Super 6 represent powerful content for implementers, but great content can't help if people don't know about it, and that's where we as communicators can help. The Power to Prevent HPV Cancer campaign was designed by the National HPV Vaccination Roundtable to promote the specialized clinical and system action guides to their intended audiences by asking professional organizations, healthcare systems, and practices to implement the promotional toolkit for 8 weeks during the back-to-school summer vaccination season. If you manage or have responsibility for the communications efforts of a professional organization, health department, or health system that reaches healthcare professionals, we have made it easy for you to sign up to receive a suite of tools to help you reach your specific audiences with the Power to Prevent HPV Cancer messages. We've created communication toolkits that include audience briefs, website copy, newsletter blurbs, 8 weeks of unique social media posts for Facebook and Twitter, as well as ready-to-go images for use on social media. You are welcome to use the copy in any frequency and in any way that you want. It's totally up to you. The only requirement is that you stop using the content by the end of August or the start of school in your area. We also encourage you to add your logo to the social images or to any of the content. The content in the social media posts directs back to that Power page on the HPV Roundtable website. However, we are totally encouraging of you linking back to your own organization's HPV pages if you have them. But we recognize that not all organizations have capacity to build pages for all of their programs or priorities. So if you do not have an HPV page, we welcome you to link to ours. It includes access to all of the toolkits as well as the social media posts. But if you have your own web page or your own resources, we definitely want you to share those. So this looks a little weird, but it's a bit.ly link. So bit.ly/power_signup. When you sign up, you will not only receive a suite of communication tools to help you promote accurate and evidence-based messages to your clinical audiences, you will also receive bonus content for National Immunization Awareness Month, and I hope that it will complement what Catherine will showcase later in this call. So we have content for implementers and providers. We have toolkits to help communicators reach those relevant audiences. But if you are a concerned citizen with a passion for fighting cancer and an individual advocate, we also welcome you to join the team. Feel free to sign up and to use the tools we have provided to help you empower the HPV Super 6 heroes in your life. The clinical action guides are a powerful tool for healthcare providers, clinical staff, health departments, and healthcare system staff, and can be shared directly with them. When we all work together, we can defeat HPV cancers. So every great superhero story has an action sequence where the fate of the world hangs in the balance. And while hopefully no one has a giant laser cannon pointed at them, this is your moment to take action to aid the Super 6. We would love for you to sign up. So go to that bit.ly link, fill out the information to get access to the suite of communications toolkits. Plan to promote the content over the summer. You can schedule all 8 weeks of content or just those messages that resonate with your audience. And post the Power to Prevent HPV Cancer content. As a tip, we suggest you roll out an image, which we have provided, with a quote super tip message, along with links to your website or to the Power to Prevent HPV Cancer website. And introducing the power of repetition. So once again, here's the link. It's bit.ly/power_signup. For those of you who believe strongly in the power of planning, here is how the 8 weeks of content are organized. You can schedule posts for all 8 weeks, or you can schedule posts just during those weeks that are relevant to your clinical audiences. This will help us all speak with one voice. So I do have a poll question. And the question is this: do you plan to sign up and download the Power to Prevent HPV Cancer Communications Toolkit? Yes? No? I'd like to, but I'm just not quite sure how, or I need assistance. I'll give people a few moments to respond to the poll. Awesome. It looks like a lot of people do plan to sign up. For those of you who need a little assistance, I have included my email at the end of this presentation. I encourage you to reach out to me, but also I encourage you to go to the bit.ly link and sign up. And then once you sign up, you might, some of your questions might be answered, but if not, I'm always available to you. So once again, the power of repetition at work. It's bit.ly/power_signup. And there, to quote a great superhero, Superman, there is a superhero in all of us. And when we all work together, we can end HPV cancers. That's the end of my presentation. Thank you so much for inviting me today. And here's my email. I look forward to hearing from you and to answering any questions you might have. And now I will turn it over to Catherine.
Terrific. Thank you so much, Jennifer. We're so excited to be able to have this webinar, our Back to School Showcase webinar featuring our great speakers on HPV vaccine resources and strategies, and to be able to share the great work that NIFIC and our partners at CDC have accomplished once again in developing this communication toolkit for all of you to use during National Immunization Awareness Month. It gets bigger every year, and I'm really excited about all the folks that I hear from in anticipation of launching this campaign and afterwards about how they felt about the tools that they were able to use. So one last polling question, because we like our polls now that we've figured out how to use them. How many years have you participated in NIAM? I know some of you have been doing it ever since we started years and years ago, just a couple of years or never. Maybe this is your first time, and so really have something for everyone on this presentation. Oh, quite a few nevers, so I'm really excited about that too. So the NIAM Toolkit, National Immunization Awareness Month Toolkit, is now available. It's hot off the press. I believe we got everything together this week. And what's exciting about having this webinar today is it's still June, and we have June and July to prepare for August. Sometimes we don't get these campaign materials. You know, some people don't get these campaign materials till it's kind of too close to the date. And now we have ample opportunity to plan out our strategy, our communication strategy, and our media strategy, whether you are a nonprofit like my organization, a coalition that has a little bit more flexibility in how you can manage your communications, or if you're working for a state or local health department or other entity that requires approval, a lengthy or at least some approval processes. This gives you a lot of time to be able to take these messages, tools, media, and graphics to your organization and have it approved in advance. And the great thing also, and what I hear from other state departments of health and other public health communicators, is that they know where these messages came from. They know that the NIFIC and the CDC have vetted these messages, so they are very comfortable with these messages and the tools that we're able to share. So you'll be able to find that toolkit on the NIFIC website, specifically nific.org/NIAM, and here it is where you can download the toolkit. As you see, you've got the capacity to download the full toolkit and the logos and banners. I download everything in a special file, so I have it all ready for myself and my staff so we can prepare some ready-to-go messages. That's one of the great things now. You can look pretty awesome by pre-scheduling your tweets and your Facebook posts to be able to move along through NIAM. So again, very similar to years past, the central messages throughout the toolkit are vaccines protect against diseases. We still have diseases in our community. Outbreaks do occur. We have a lot, unfortunately, we have a lot of experience with that the last couple of years in the United States and elsewhere, and we can use those stories and bring in these messages to be able to share those with our community. Whether your community is health professionals or your community is the public. Obviously, vaccines are recommended throughout our lives, and this campaign is tailored to highlight the importance of vaccination across the lifespan. And again, the opportunity to remind our communities that vaccines are very safe and very effective. The objectives of National Immunization Awareness Month is to highlight the value of immunization for all ages, disseminate these coordinated messages, and especially utilize social and digital media to reach our target audiences. So, drum roll, please. So we've got the themes for NIAM 2018, and we've got, it's broken up into weeks generally. Close to the end of July, beginning of August is where we're pushing out messages on back to school. August 5th through 11th, pregnant women encouraging mothers to protect themselves and be able to pass protection on to their babies. Starting August 12th, we've got babies and young children, a healthy start, beginning with on-time vaccinations. Preteens and teens during the week of August 19th, and August 26th to 31st gives you a really good chance to promote flu vaccine and to remind adults that vaccines are not just for kids. We've got a lot of opportunities to vaccinate adults from childhood on. A lot of people don't feel they're vulnerable, and of course we know that is not true. Everybody needs to be protected. However, I wanted to mention that these campaigns, while they are broken up into themes during weeks, they are not. You can, as in your organization, your state can control this. Put the campaign together for whatever suits your needs. You can move these around if it works better for you to do something for adults early on in the month. It's, of course, perfectly fine. Some coalitions or other organizations, they're focusing maybe more heavily on maternal vaccinations, and so they may use NIAM just to focus on that during the month of August. And that's what's wonderful about this campaign, is you have the capacity to tailor it to your needs. So really quickly, I'm going to run through just some sample graphics, which are similar to years past, around our back to school. These are graphics, images. Be sure to download those banners and graphics. It makes it super easy to be able to get these out into your different social media platforms, or use them on a header within your websites, again on your Facebook posts, and or on your Facebook cover, on your Twitter cover, as well as any print material you might be sending out. I want to highlight, and I didn't get this updated before we had our start of our program, but the communication toolkit specifically has tips for communication and media relations, and so you'll want to update yourself on that tool, part of the toolkit as well. That's all been updated. While the graphics may look similar in the past, the toolkits have been slightly updated with new messages and updated information. Wanted to highlight some of the resources within the toolkit, sample key messages. I use those a lot to create some of the tweets and posts and Facebook messaging. Again, tailoring it to your local needs or something else that's going on in your community or in your organization. Specific vaccine information, frequently asked questions, which are really great to be able to share with the media or parent groups, other professionals. Sample news releases and drop-in articles. Great opportunity to get information out through your newsletters, online tools. Sample social media messages. I have to say I use this a lot because it's so great to be able to plug that in, as I said earlier, into the platform you use. I use Hootsuite, where you can set up the messages, schedule them for the weeks, and then I add other things as I find news articles and other information, but at least I've got those messages scheduled. Logos and graphics. It's all about the visuals now. So you want to be sure you're adding visuals wherever you can in those tweets, and so there's lots of great resources there. And web links and resources to continue the great work. I think I got ahead of myself. So that communication toolkit was first, and then I also want to reference back the media outreach toolkit. So as you see, you can look around on the NIFIC website toolkit section for all of the information there, and it's terrific. We also love to hear your feedback. I may mention this again at the end, that there's also an opportunity. We want to hear about what you did in your community during NIAM and how you feel your campaign was effective, and also what else you need as communicators. Again, some pretty pictures, banners, very subtly different depending on what you need in your community. And there's a lot more. These are just a sample. But I want to mention, one more time about getting social, about promoting vaccinations. I had the opportunity yesterday to speak with a group of international health leaders. They were here as part of a, leadership program sponsored by the State Department, and we had a really great discussion at the end of our presentation. They were learning about coalitions and how we do our work in California. What was and we had individuals from Nigeria, Romania, France, Malaysia, Mexico. It was a great opportunity. One of the things that we did share, the United States shares with these countries, is the impact of social media on parents and how some of the choices that they're making, based on what they're hearing in social media. I thought that was fascinating. And we know that while there is negative information online and shared through social media, we have the capacity and the opportunity to get even, a lot more messages out there and to direct people to the credible sources and be the voice for science and for the facts that are so important. It is a challenge, but I think it's very possible, and it was heartening to see how many wonderful partners we have in the world, in addition to the United States. Wanted to mention, of course, these are some of the platforms we use. And Instagram, of course, has added Instagram video, which I have not dipped my toe into, but I think that's going to be another great opportunity to be able to communicate with our stakeholders. Again, use those sample social media messages provided in the toolkit to promote vaccination. Hashtag is NIAM18. Also consider vaccines work and vaccines, hashtag vaccines work and hashtag vaccines. We have used Team Vax in the past, so I may change the slide up for the final posting, but we'll post all the other hashtags in case I got this wrong, because I used a slide from last year. But you want to use those hashtags that everybody else is using so we maximize our resources here. So I'm looking forward to questions and answers at the end, and my NIFIC colleagues to help me if I forgot any of the key items there. But again, very excited to be able to share this campaign with you right on time. We've got it posted this week, and looking forward to hearing about what you are doing in your community. So I'll hand it back to you, Tom.
Okay, thanks, Catherine. And thanks to Ian and Jennifer. We are excited about the great work that's going on and the opportunity to use NIAM in August to help promote immunization awareness. Now we have time for some questions, and I'd like to remind you that you can ask a question by typing it in the lower left-hand corner of your screen. And Catherine's going to come back on here, and she's going to moderate the Q&A portion of our webinar. Catherine?
Great, thank you very much. One of our first questions is, how do you get a provider that is set in their ways to highly recommend HPV? And that's for Ian or Jennifer?
Yeah, this is Ian. I can I can talk a little bit about that. I mean, I think one thing, and I think that's difficult, and I think one thing I would say is the value of peer-to-peer influence is really important. And I think that if there are HPV champions that can influence providers who are set in their ways, and whether it's somebody, a leader in cancer, or another pediatrician who can talk about the important role that HPV vaccination plays in preventing future cancers, as well as that can kind of articulate how to make an effective recommendation and how it's something that can be implemented into their practice, and really that it doesn't have to add additional time to their visit, and it can actually shorten the conversation with parents if they are giving a simple, concise recommendation for HPV vaccination. One of the materials that we developed to try and get to that peer-to-peer aspect is the How I Recommend video series that I mentioned, that features practicing physicians who are achieving high vaccination rates, and they're talking about how they overcome some of these questions that parents have and how they are effectively recommending the vaccine.
Excellent. Any thoughts on that, Jennifer?
Just to echo what Ian said, that there is a lot of evidence that short, concise, presumptive recommendation on behalf of the provider, but as on behalf of also the entire medical team. So the MA who might be taking the family back to the clinical room, the front desk staff who's welcoming them into the office, without having the entire clinic on board with a pro-vaccine message has been shown to be really, really helpful. One, it socially norms the vaccine, and two, the parent feels that they're in a welcoming space where if they have concerns, they can ask them, but they're not sort of being led down the path of, do you think you want this? Parents are really looking to the medical team to give them unbiased and accurate medical information.
Perfect, thank you. I'm going to hop around a little bit on the questions here. Love this one. Has there been a consideration or some conversation about developing a, quote, How I Recommend video for pharmacists, and additionally an action guide specifically for pharmacists? We know a lot of people are getting their vaccines in the pharmacy.
This is Ian. We've certainly been discussing additional audiences that we've considered expanding to for How I Recommend. At this point, our primary focus has been on pediatricians, family physicians, and we'll be expanding to nurse practitioners. But I think we're always trying to consider additional audiences that may benefit from this.
Yeah, sounds like a great idea. One of our questions is about some of the materials here. Are the front and back flyers for providers available online or to order? Something that our speakers referenced earlier.
This is Ian. I can speak to the flyers that I mentioned, which are all available on our HPV website, which is cdc.gov/HPV, and they're under the clinician section of our website. I believe the Talking to Parents About HPV Vaccine fact sheet and the iceberg will be available for printing later this year.
Excellent. Another question is regarding providers and recommending HPV vaccination for boys. If they are not as familiar with the updated recommendations? How do you get providers to recommend HPV for boys if they are not, if they may not believe that the science is there for boys?
I think that goes back to the segment of clinicians that I mentioned of that they may not be aware of the true burden of HPV disease, and I think that we've developed a lot of resources to help educate providers on the burden of diseases beyond cervical cancer, so the cancers that HPV causes in boys. And I would also say that we're encouraging providers to talk about to normalize HPV vaccine conversations, recommend it the same way for all their patients.
Mm-hmm. Excellent. Any additional thoughts on that, Jennifer?
Yeah, I would just say, the ACIP issued the vaccine recommendation for boys and girls, and they did not just arrive at that recommendation. They studied the evidence base in the literature, and so these are really smart people who have as their job sort of do this, and so I think that the evidence base is there. So I would, encourage them to familiarize themselves with the ACIP recommendation if they don't think that the science is there for boys. But also, human papillomavirus is an equal opportunity infection agent, and even if they don't think that the disease burden is there for boys, I would hope that there would be some recognition that boys play a part in transmission. So if they believe that there is an evidence base that HPV vaccination is effective for girls because it prevents infection, which can prevent later diseases, including cancer, then hopefully they could buy into the logical argument that if you can prevent boys from getting infected, you can also then prevent their partners from getting infected.
Terrific. Thank you. I think that's very helpful. So one of our participants asks, based on all of the available resources that you as experts have been helping to produce and are seeing out there for increasing provider recommendations, can you able to highlight which ones you feel have been best received, most effective? Are there some of the tools or mechanisms for distribution that you feel or that you're hearing are most effective?
I can speak to the resources that I mentioned, and then Jennifer, if you want to talk to the resources that your group offers. I'll say that our "You Are the Key to HPV Cancer Prevention" slide deck has been kind of one of our foundational pieces, and I think it's been a really helpful resource for educating providers and ensuring the whole office staff is on the same page. So I definitely would highlight that one. And I think that our tips for talking to parents about HPV vaccine has been a really helpful one-pager that providers can quickly, it's very simple and easy to read, provides practical, concise responses to parents' questions, and that's a resource that we've had for a few years now, and it's been one of our more popular resources. So I would definitely highlight those two resources, and then two of the resources that we have that are a little bit newer, so we don't have quite as much to go on for that yet, but definitely I would say our How I Recommend videos. We're seeing the importance of having materials available in formats that are digital and mobile friendly is really important, and having that peer-to-peer aspect of showing a provider who's achieving high rates, talking about what they do in their practice, I think has been really important, and people have really been receptive to that. And then I think the iceberg graphic has also been kind of an eye-opener to a lot of people about how much disease HPV causes beyond just cervical cancer.
Right.
Yeah, and this is Jennifer. So in addition to the How I Recommend videos that CDC has produced, which are excellent, the HPV Vaccination Roundtable produced a series of videos with HPV cancer survivors, and some of them are survivors who are interviewed along with their care provider. And we also have a short video with a caregiver whose mother passed away from HPV-caused anal cancer. So the videos showcase, female and male survivors, cervical, oral, pharyngeal, anal. The Department of Health in Iowa has developed some amazing survivor videos. They have a particularly moving video of a gentleman who was a penile cancer survivor, his cancer caused by HPV. These videos, we show them at our meetings. I've seen them shown before webinars. They've been used in Grand Round, and they are really powerful. We're hearing through some evaluation work that we've done that they are really, really powerful for pediatricians. As Ian mentioned, HPV diseases tend to not occur in childhood, and so pediatricians don't routinely see them in their practice. So this is a way to bring the stories from sort of the oncologist or the gynecologist or the otolerologist, I can never say that word, but the head and neck surgeons and the gynecological surgeons and the oncologists can say, don't let your patients become my patients. And we found that to be really powerful. We formatted the videos. They're very short. I think at the longest they're 5 minutes, and they can be edited to be even shorter. So if you are interested in using them, you can find them on our website, hpvroundtable.org, or you can email me and I can definitely connect you to the library.
Great, thank you. We have time for one more question. Let's see. A participant wants to find out where to find the scripting sheet to mail out to patients, letting them know what vaccines they are due for. Did we answer that, or did you?
I can respond to that after the call if you'd like. I can send the specific URL, but it's available on our HPV website, www.cdc.gov/HPV, underneath in the clinician section.
Right. Perfect. Thank you so much. I wanted to give our speakers one last couple seconds there to give us some final thoughts. Maybe something we didn't get to. I know we got a lot of questions coming in at the end, and we'll be able to respond to a couple of those specifically. Any final thoughts, Jennifer or Ian?
Sure.
I'll just say, yeah, you go ahead, Jennifer.
Go ahead. Well, I just wanted to say thank you for inviting me to be on this webinar. The VIC network directly represents the audience that we are trying to reach with our communications toolkit, so I greatly appreciate this opportunity. Someone in the chat had asked about materials in Spanish. We don't have any of our Power to Prevent HPV Cancers materials in Spanish. However, we are very open to collaborating, so if you represent an organization that has capacity to translate, we can make all of the files available. None of our files are copyright. You don't need to sign a licensing agreement. So if that's something that you think your organization has capacity or could connect us with someone who has capacity, we are very interested in creating multilingual resources. We just don't have that capacity on staff. So please reach out to me. Thank you so much for those of you who tried the bit.ly link. It is case sensitive. I'll put those back in the chat. But if you have any questions, the best way to go about it is just to email me. Thank you.
Yeah, and we'll put something on the VIC network site. Quickly, Ian, any couple words?
Yeah, I just want to put in a final plug for our HPV Champions Award. We're really excited to launch the second year of the award, and we think it's a great way to recognize healthcare professionals who are really leading the way in preventing cancers in the future. And it's a great way to be able to share effective strategies that are being done on the ground with across the country. So I would just encourage you, if you know of a provider or a clinic or a health system that's doing a great job with their HPV vaccination rates, I'd encourage you to submit a nomination to your state or territorial immunization program.
Perfect. And we will post that champion information on our VIC network site as well. Back to you, Tom, and we'll wrap it up.
Okay, thanks, Catherine. One real quick thing, there was this question about Spanish. I wanted people to know that all the NIAM material is being translated into Spanish and will be available soon, so check back to the NIFIC website for that. Again, thanks to our presenters for sharing their time and expertise today, and thanks to everyone for attending today's webinar. We hope it was informative and helpful to your immunization efforts. And just a reminder here, don't forget to complete the evaluation form that will automatically appear after this broadcast. Your thoughts and opinions are important to us and help shape future presentations. And I know people have been asking, we will be posting this webinar on the VIC network and CDC site soon, along with the slides. And thanks so much for joining us.